people in the Philippines opt not to visit a doctor. And what would you tell these people regarding their reasoning to not wanting to go to the doctor?
So I think there's a lot of reasons, but the most common ones will be of course financial reason,
Mm-hmm.
and the knowledge that the lack of knowledge that there are some institutions who can help, like the PCSO, like the DSWD, and even their local government. Some of the official gives financial support.
Now, what are the PCSO?
PCSO is the Philippine Charity Sweepstake Office.
Okay.
The one doing the lotto.
Oh, okay.
And of course the PAGCOR, the Philippine Gaming Corporation, they also give financial support.
Mm-hmm.
And the DSWD, Department of Social Welfare and Development.
Okay.
So these are the institutions who give financial help
Okay.
to patients. So sometimes it's the will. It's the will of the patient or their relatives to help themselves. Sometimes, like for example, in our dialysis center, if they run out of free sessions from PhilHealth, we give them the options to seek help from other institutions.
Mhm.
They need to just secure papers from their barangay halls, but sometimes they don't move. I don't know why.
Mm-hmm.
I don't know why they don't want to move.
Right.
Because some people, I really don't know. They don't have the will to help themselves. They want it to be just be given, you know.
Which is sad, because often enough if they have a problem and they keep with that mentality, it ends up being detrimental to what could be a relatively affordable and easily treatable problem, which over time through lack of treatment becomes extremely unaffordable and a bigger problem, and at times
the patient can die.
Yes.
And
they'll
I
die
don't
from it.
understand. They will cry.
Right.
I really don't understand, because we have a lot of patients who die because they don't go to dialysis sessions. They go to dialysis sessions even if they were already guided. They're given options how to seek financial help.
Mm-hmm.
So hopefully, the universal healthcare bill will increase the sessions of dialysis,
Right.
because this dialysis patient, having them as examples, they go dialysis 2 to 3 times per week
Mm-hmm.
for the 365 days, and the PhilHealth only gave us 90 sessions. Of course, we are thankful,
Yeah.
but it's not enough, especially to people who are underprivileged. But then again, there are also some institutions who can give support. It's only the
Right.
will that they need to help themselves. They need to help their family members.
Mm-hmm.
Yeah, they need to be pushed sometimes.
Well, and I think honestly, not even necessarily pertaining to medicine, but just overall, there is a strong aversion towards bureaucracy, towards paperwork, towards having to go into an office, towards having to fill out paperwork online. People
Agreed.
just they put it off and they put it off, and I don't know if it's because they're
I think,
afraid of bureaucracy or.
But I think it matters. The bureaucracy affects
Mm-hmm.
in a negative way.
Yes,
In a negative way, because remember, if you go different office, it entails transport.
Mm-hmm.
Transportation fee or allowance. So if you have this little amount of money, and then you need to go to different, maybe that's one of the reason why they're not pursuing to secure papers, because they have to go different areas. So I think streamlining the process
Mm-hmm.
will help a lot of people.
Yeah, having a secure government website that allows
Yeah.
people to sign up for everything.
Yeah.
And even then.
Or an office wherein all the agencies of the government are in there.
Mm-hmm.
So that is just a one-stop shop.
Yeah, that sounds like a really great solution to this
Yeah,
problem,
because
having
actually
a
our
centralized
yeah.
location in each
Actually, the
city.
President already did such kind of setup in OFW. OFW is overseas Filipino workers,
Mm-hmm.
to make it easier for them to process a lot of paper. He put all the agencies that are involved in helping the OFWs
Mm-hmm.
in one place.
Okay, so some attempts to streamline
Yeah,
agencies is happening. Just
Yeah,
go with the
yeah.
OFW.
I hope they will do that also in health.
Well, maybe they're trying to see if it's effective before they start institutionalizing it with you guys. So I mean,
Yeah.
because if I'm not mistaken,
Hopefully,
it's about 10% of the Filipino population that works abroad, so roughly about 10 million people, something
I
like
think
that.
it's more than there's
More.
a lot of people working abroad.
Mm-hmm.
Yeah, because the benefits are great abroad.
Just
the
not in
salaries-
Saudi Arabia. Stay away from that place.
Yeah.
Yeah. So there's a lot of people working abroad. So
Yeah.
there has at least been an attempt to try and streamline. So hopefully through the
Yeah.
success of that organization,
Yeah.
it'll transcend into your affiliation. Which
Yes.
I mean that
agree.
I think that would be great because that's one thing that has been attempted in the United States for healthcare was building healthcare.gov, which
Oh,
was a
I see. That's
website,
great.
which every now and then it goes down, but I mean it does work to some extent. But it was
Yeah.
actually based on masshealth.gov, which
I see.
was originally built by Mitt Romney,
I see.
the candidate against Barack Obama back in 2012. So
Yeah.
we've been in the United States. We've been trying our best to try and tackle our healthcare problems, and like you said, a lot of it is coming from the lack of streamlining.
Yeah.
So hopefully, countries across the world are starting to
It's
realize.
a lot of inconvenience actually.
Yeah,
you
and
know,
the
going
internet
to
is so helpful.
Yeah. So that's one of the reason why I think people will not go to. I mean, will not help themselves.
Yeah, it's.
Going back to the question, I think the stigma.
Mm-hmm.
The stigma also prevents people from going to hospital or clinic. For example, tuberculosis. We know for a fact that tuberculosis and even HIV, there's medications.
Mm-hmm.
But yeah, maybe being in a Catholic country still have some effect to people. They don't want to be seen going to the health center. They don't want to be seen to go to the HIV testing center because they are afraid
Mm-hmm.
to be judged by people.
Yeah, a modern day leper,
Yeah, actually.
even though they're not.
Yeah, actually, because this kind of diseases are actually controllable
Mm-hmm.
if all the recommendation will be followed.
Mm-hmm.
So yeah, I think lack of knowledge. Because if they are aware that these are treatable, then it's okay.
Right.
It's okay that it's not. I mean, you cannot acquire HIV because of the mosquitoes. You cannot. You will not acquire HIV because of the saliva.
Mm-hmm.
So still education, especially in the rural areas. In the
Mhm.
cities, yes, but in the rural areas, again, because most of our health professional and health educators are in the city, then less is less, the knowledge is less in the rural areas, I think.
And also, I think something about rural areas, and as well as the citizens in rural areas, is those who succeed and are ambitious and driven, they leave.
Yeah,
They don't go back because, for one, there's more opportunity, and it is a better life a lot of the times in the urban
Yeah.
areas, which means
which
the-
is actually difficult. You cannot really blame them.
no,
Yeah,
this is just
very
kind of
difficult.
a kind of a subject that's been happening for the last 200 years or so. Is people who are in rural areas, they go towards the urban areas because there's more opportunity for them, which means that their families that they leave behind.
You know, I'm reflecting for the past few days if the minimum salary wage will be equal for the city and the rural area, will it affect the brain drain or the people leaving from the provinces?
I would think, in all honesty, you might have to offer more in the provincial areas
I
because
think to attract more.
because
Yeah, I think
there's a lot of convenience you give up by going into the provinces.
Yeah.
Although there's a lot more to gain from a altruistic point of view.
Yes,
Much
yes.
more, but your convenience factor just skyrockets. I mean, considering you have 4G available here on your phone pretty much at all times.
Yeah,
You go into the rural areas, and yes, it's
It's very
quiet,
difficult,
there's
yeah.
crickets, but
yeah.
you don't have the high-speed convenience of
Agree.
being able to use your telephone, which
Yeah.
also goes hand in hand with the lack of
Mhm.
education. You don't have the constant discussion amongst people about what's happening in the urban areas. So I think that's definitely a big problem.
Again, one reasons maybe not people going to the hospital because some of the hospital in the rural areas are not properly equipped.
Mm-hmm.
So there's still some people who just go to the what do you call this, the herbalist or
The witch doctor.
herbalario. I don't know what do they call it in
The
excuse me.
a new age health provider. They're
Yeah.
gonna give you some crystals.
Actually, I have no problems with the crystals and even the medicines, but of course it will not replace the medicines with what do you call this? We are now in the era of evidence-based medicine. We don't just give something that don't have evidence because it may cause more harm than help.
Like the rhino population being wiped out
Yeah.
for their horns, because you have a lot of people who think that those are great
Medicinal
for the
properties, yeah.
when they don't,
Yeah.
and it's just killing animals.
You know, our nature is very rich in and it's very rich and has, I mean, I'm sure there's still a lot of plants and organisms that's not being explored yet that
Mhm.
has an active properties that can actually heal some
Mhm.
of our diseases. But again, you don't just get plants or get any fluids of any organism. You just have
Right.
your patient take it.
Yeah, and I mean, realistically speaking, a lot of pharmaceutical items are based on plant treatment, but they take it down to a molecular level
Yeah,
and take out the chemical
the only
components
important
that
one,
are found in, say, an eucalyptus or something like that, and combine it with
yeah.
a lot of other
Other
different
stuff,
aspects.
yes.
But there's definitely some healing properties that can be found in plants,
Yeah.
but there's a reason people go to college for 8 years or
Yes,
so
agree.
to study pharmacy.
So there. So if you send going back, if you send the patient and the hospital or the medical facility is not well equipped,
Mm-hmm.
it seems that you're doing nothing to the patient. The trust will not be earned. It will
Right.
be lost. Hence, sometimes people will not bring their patient to the hospital. So again, we have to improve our facility. We have to improve our manpower.
Mm-hmm.
Again, human resource and of course the equipments inside the hospital.
Mm-hmm.
At least every municipal, because I experienced it like a few years ago. We went into a province to have like to go beach,
Mm-hmm.
and then one of my friend got shoulder dislocated after being sleeping. Sleep, and then we went to the nearest municipal. It's already municipal level, municipal hospital,
Mm-hmm.
and the equipment is not. There's no ortho doctor. The X-ray is not properly functioning, so we have to go Manila. So we went bus just
With
You
his
know,
dislocated arm.
dislocated
Yeah,
arm.
you're
This
just like,
is really
just hold it in place, you'll be fine.
the experience really horrible.
Right, and then on top of that, from a financial point of view, if you're working day to day on your labor, you can't necessarily afford 2 days of
Yeah.
going from one place being told, oh, sorry, we're not quite equipped to handle this, go check out our other doctor who you have to
Yeah, and
pay
then
to
you-
go see.
Of course, they're asking us to go to the other hospital, but they're not sure if there's doctor there. So we just decided
So
to go Manila.
there's no communication. I'd be like,
Yeah, the
maybe
referral
go-"
system is not good.
Right.
So again, going back to the human capital,
Mm-hmm.
much of the specialists and subspecialists are in the city,
Mm-hmm.
less are in the province. So if you need to manage this kind of disease which is rare, or you need expert skills in managing the disease, it's not available. So sometimes, to put it bluntly, they will get tired
Mm-hmm.
to bring the patient to because there's no ambulance, there's no helicopter. Of course, if you're rich, if that patient
Yeah,
is
if
rich,
you've
they
got the
will,
money, you got a limo to get.
yeah, they will have the patient in the city
Mm-hmm.
or in Manila,
But
fly
most
to
people
Manila.
don't.
Yeah, but most of the people in the provinces don't.
Right, and then
So they will just stay in their homes,
right, and that's
the
where
comfort of the home, and just
die.
comfortably. At least because most of the of the people in the province, they want to expire in their homes.
Right,
So
with
most
their
of
family around
yeah,
them, the support, the comfort. So I mean, it's
so the lack of trust, or because of the equipment is not in the, I mean it's not complete, and the people, it's not, the right people are not there,
mm-hmm.
they rather decide, you just stay at home
I'll
and
just stay at home and
be
with
there
my
peacefully,
family.
and you know.
When it could be something that's treatable too,
Yeah, exactly.
but it's the lack of availability of healthcare in the provinces. So
Because you know, I'm talking like this because I was comparing it in Singapore.
mm-hmm.
The patient is already dying, but because of this high tech and well trained professionals, I'm not saying the Filipinos are not well trained, but I mean we need more in the province.
Right,
We need
and
more
you
expert
need
in
the
the province.
equipment there too. I mean,
Equipment in the
you can be
province.
as great of a doctor as possible, but if you
Yeah.
don't have the equipment necessary to perform a surgery, you can't do it.
Yeah, because
And that's not even
you know how
on the
can I
doctor.
compare? I mean, just a personal experience. When I'm in here still here in the Philippines, patient dies like 5 per day, 5 to 10 per day,
Mhm.
per 24 hour of duty. While in Singapore, it's like 1 to 2 every week.
Really?
It's like a mortal sin to have patient die. And I'm in the cancer. I'm in the cancer department.
Mm-hmm.
And sometimes people will think cancer is gonna die, and then you're expecting a lot of people dying day per day. No, there we only have like there's a lot of months where we only have 1 to 2 deaths, and that's cancer already. They're really very good. The Singaporean
No, do they have a lot
healthcare
of
system.
preventative health care though to ensure that people live a long life?
Actually, I'm not the authority to say because I only had my duty in the cancer department. I haven't seen the other field of medicine in Singapore, but suffice to say, the management, even if the patient is in the terminal stage, it's really excellent.
I'm
It's
gonna
really
have to go.
excellent.
My friends all told me don't go to Singapore because it's boring. I think we need to check at the hospital. So guys.